This is Biernacki. Today I'm talking about flat feet. So watch this. When your foot flattens out like that, when your arch collapses, it stretches the inside of your ankle. It gives you shin splints. It gives you knee problems. It gives you hip problems. It gives you back problems. It prevents you from losing calories. You can't go on walks. Your back hurts. Your knees hurt. Your feet hurt. Is it your shoes? Is it your orthotic? Should you try barefoot shoes? Should you try these huge, gigantic shoes? We're gonna go over all the research, all the practical studies. This works for my patients, and I'm gonna show you the big trick at the end. We're starting now. When patients come see me, they almost always have some type of biomechanical issue. Hip problems, knee problems, flat feet, shin splints, even kids. I see kids come in all the time and their parents think it's growing pains. Guess what? There's no such thing as growing pains. Growing pains is really kids developing pain due to flat feet, biomechanical issues until they just stop playing sports. And now more kids than ever stop playing sports. More adults just stay at home. They're less active. People aren't going running as much. They're not as athletic. Obesity rates are going through the roof. Flat foot is getting worse. I'm seeing even more. Even with all these advanced technological improvements, the best custom orthotics, the best shoes, the best barefoot shoes, none of this stuff is really improving it. So we're gonna go over what really works, what the studies show, and I see this stuff practically every day. I've seen this thousands of times, so many people wasting money. So I wanna make sure you guys are not wasting money and you're finding the best possible tips and tricks. Flat feet are more common than high arched feet. It's estimated that about 30% of the population has flat feet to a degree. About 10%, in my opinion, have a very high arched foot. Everybody's got a tight back, tight hamstrings, tight calf muscles. This all leads to a condition called overpronation. What's overpronation? Basically when your foot does that. When I consider a high arched foot, I actually look at the bone structure. If someone has a high arch like this, then what happens is that's more of cavus foot. But if the middle of the foot is collapsed like this, then that's more of a flat foot. If the foot turns out like this as you're walking and your foot turns out like this, that's overpronation. Even a high arched foot can overpronate. And what happens is when you overpronate, your knee buckles in, your feet buckle out, you put more pressure on your back, your muscles have to work way harder. It leads to the development of osteoarthritis. This is a very confusing topic. This is where a biomechanical exam with your podiatrist comes in because there's heel spurs, there's Achilles tendinitis, there's shin splints, there's nerve problems, there's joint laxity, there's knee problems, there's hip problems. I deal with all this stuff. If you're in Michigan, I'd love to come see you. We're gonna go over the top 16 things you can do at home. There's 4 grades of flat foot. Grade 1 is very mild. The arch is normal, it's still visible, but you develop some aching pain through your arch, through the bottom of your heel, through the inside of your ankle usually, and the outside of your ankle. A grade 2 is visible flattening. Your foot starts to flatten. One side can be worse than the other, and not only does it ache, but the visual changes start to develop. Grade 3 is when the arch is completely flat, when it flattens all the way to the ground. Grade 4 is when the ankles start actually buckling, and it becomes hard arthritic. In grade 4, I take x-rays on patients because arthritis starts to develop then. That's when you start to think about procedures like surgery. Starting with number 16, medications. Over-the-counter medications like NSAIDs, non-steroidal anti-inflammatory, steroid medications come in. These are your naproxens, your Aleve, your ibuprofens, your Tylenol. Guess what? None of these really work. They all help with pain. And there's even stronger medications for pain. You can take steroids. I've had patients even take opioids when they're coming to see me. I try and stop that. Pretend this is your foot and someone's just punching you. Every day they're punching you. And you're just numbing the foot. You're putting creams on it, you're putting medications on it, but you're not stopping the punch. We want to focus on stopping the punch, so I won't get into the medications too much. Number 15, the best specific medications, if you did have to go to Disney World or you have a work shift that you absolutely have to get through, anti-inflammatory medications like ibuprofen are a little bit better than things like Tylenol. Tylenol works more on your brain to prevent the feeling of pain, whereas ibuprofen actually cools down the swelling. I don't think any of these are great options. There are studies on these. The results are not good for the punching reason I just showed. Number 14, topical medications. There's creams like Voltaren. These can be prescription anti-inflammatories. The reason I rank these above the medication is because they don't actually enter your bloodstream. You can get them put on your arch, your heel. If you just have a flare-up, I've had a lot of patients where this solved their problem completely, but again, it doesn't get to the root cause. Number 13, natural medications. So this includes topical, and oral. I have a lot of patients where they come in with CBD oils, they come in with things like BioFreeze, things like capsaicin, which is chili pepper extract. All of these can work. There are some beneficial creams. Don't get me wrong, these help relieve the pain. But again, I get to the point where we want to solve the root cause of your flat foot. We just don't want to solve the pain. This can also include ice packs, capsaicin, CBD oil. Number 12, weight management. The reason weight management is so low is because weight management is overrated. It's not that we shouldn't all get in great shape, because we should. If you lose 1 pound on your core, it's said that it takes 5 pounds off your foot. As you're walking and leaning, you're actually standing on one foot, you're coming up and down stairs, there's a lot of momentum. So 1 pound of body weight really puts a lot of pressure and momentum on your foot. Losing weight is hard and slow. We can actually fix these flat foot problems and these joint problems within a few days or a few months. That's the time frame we want to look at. If you're someone who's like 300 pounds, the reality is you should get in great shape. And I don't think any doctor would fight that. It's not going to be quick. Even if you're doing it perfectly, you're not going to lose the weight you need to make a difference within about a month or 2 months. We want some quicker results. So the answer is, it is important to lose weight. It is important to get in great shape. You should be in a good BMI range, and it will help your feet, your ankles, your knees. It makes a big difference, but this is not the first thing you should start doing. This is more of a general body problem that you want to solve. A study in the Journal of Foot and Ankle Surgery in 2006 actually emphasized the role of body weight management in flat feet. It's shown to be very effective, but it's kind of low on the list because it's a very slow and not immediately effective result for this, although you should definitely do it. Number 11, injections. There's a ton of injections. There's steroid injections, there's numbing medication injections, there's something called prolotherapy, which is sugar water essentially. There's PRP, which is platelet recombinant plasma. There's stem cell injections. There's even Botox injection. I've tried doing the vast majority of these. I don't think I've done Botox, although I have a good friend who does it regularly for tight calf muscles, for people with spastic problems. If someone's punching you in the foot, you don't want to just numb the foot. You want to stop the punch. Injections can be very effective, but really all they're doing is shutting off your inflammatory cycle. You can inject the bottom of the heel, the ankle, certain ligaments, especially if you have nerve compressions. I do diagnostic nerve compression injections to see if that's where the pain's coming from. If you have flat foot pain that's not getting better, I love to do an injection to make sure that it's not a nerve compression and to see if it goes away. It does not attack the root cause of the problem. Injections, even though they're a great tool for a podiatrist's tool belt, it's not at the top of the list. Studies show that steroid injections can be very effective for painful feet, but they do not want to be a long-term solution. Number 10, activity modification. If you're someone who stands on their feet 12 hours a day and your feet are collapsing and your ligaments are ripping, you want to change your activity. Or if you're a runner who's running 20 miles a week, you want to maybe do some swimming, some biking. You have to look at activity modification. This is an important part of the process. If you're injured, you cannot heal and get better. This is going to be a big focus. Your body is designed to heal. It wants to work properly. It's very important to give it a chance. And when you're healed, that's when you can be more active and do it safely. I write letters all the time. If somebody's injured standing, that's when people come see me. I write my notes. Jobs are usually very accommodating now. Number 9, surgical interventions. I put this on this list at all because it's something that's searched, but I don't believe in flat foot surgery as much as I used to. I used to do a ton of these procedures, so it's not that I don't do them. I do them when they're needed. The vast majority of people, especially young people, do not need flat foot surgery. I feel like if people don't get better in 1 or 2 days and their insurance doesn't cover orthotics, they're already getting booked for surgery. But that's not a good idea in my opinion. There are surgeries to loosen tight calf muscles and rebuild the arch. I have never had a kid that did not get significant improvement with orthotics, good shoes, bracing. We're gonna look at the better options, but surgeries here include Achilles tendon lengthening, equinus correction. There are a ton of studies. Listen, this is where hospitals and doctors and surgical centers make all their money. All the studies are geared on how awesome surgeries always are. Have you seen that in medicine before, where potentially the most money-making solution has the most studies? What a coincidence. And the free, cheap, and safe ones almost have no studies. That's the crazy part about medicine sometimes, is there are great solutions, but no one's really incentivized to promote them or study them. We all know it works, is one of these scenarios. And flat foot is one of these scenarios in my opinion. And hey, I'm probably missing out on my Ferrari by telling you guys this, so give me a thumbs up if that helps. But I'm a big believer in this. You know, I see so many people that have these huge reconstructive surgeries that say it's their biggest mistake that they ever made in their life. So I'm not saying that you shouldn't do them, but try the other stuff. Number 8, taping and bracing. Taping and bracing can be very effective. I used to do a lot of taping, but the reality is it falls off within about 1 appointment. So I'm gonna kind of skip the taping methods. Although KT tape works great, wrapping along the inside of the ankle works great, wrapping your plantar fascia works great. You can use some nonstick spray if you're an athlete and tape up your ankles. Physical trainers for football teams do an amazing job. So if you sprain your ankle, if you have flat foot as an athlete, great techniques. You definitely do that. Braces are just so much easier. Braces are now low cost, they fit well, and they're very effective. I love braces like Taco Brace, for example, and there's a lot of great pre-made braces that are very cost effective. If you're someone who suffers from flat foot pain, don't get one of those compression braces. So there's compression braces for swelling. They won't hold your foot straight. You want to get a triple layer compression dressing. I go over my favorite ankle braces down below. I link my favorite ankle braces down below, but ankle braces are very, very effective. For flat feet, you don't necessarily need a boot like this, but more of a brace like this. So there's braces like this, there's lace-up ankle braces. I link to a lot of great braces down below. Whether you're a really big person or a smaller person, there's the correct brace for you. Check out my list down below. There are a lot of studies talking about how great ankle braces can be. If you ever saw the movie Forrest Gump, that's what made Forrest Gump one of the best runners in America. He basically became an All-American due to his metal rigid braces, so you can definitely test them out for a day or two. Number 7, physical therapy. I love physical therapy. A lot of people have weak back, weak hip, weak knees, weak thighs, and you want to get evaluated by physical therapy. So when patients come to see me, we have to identify and diagnose the proper muscles, the proper joints, and this leads to the proper stretches, flexibility, and strengthening. There are a ton of studies how effective physical medicine rehabilitation can be for individuals with flat feet. This was published in 2018 in the Archives of Physical Medicine and Rehabilitation. Number 6, shockwave therapy. I love shockwave therapy. This is something I offer in my clinics when patients come visit me in Michigan. And this is more for the pain. When people have stiffness through their Achilles tendon, through their calf muscle, through their plantar fascia, through their posterior tibial tendon, through their perineal tendons, the shockwave therapy essentially uses sound to massage those joints. Essentially someone who's stiff and tight, and when I measure one foot tighter than the other, we use shockwave therapy, right away it starts to loosen people. And then as we hold them straight and address the actual underlying problems, they almost immediately start walking better. Now this doesn't last forever. We still have to do the other things on this list. Shockwave therapy for things like plantar fascia, tendinitis, stiffness, spurs, very effective. There's a lot of research on extracorporeal shockwave therapy, a lot more coming out. There's some good studies out on the specific tendinitises and stiffness already. Number 5, stretching exercises. Stretching the calf muscles, the Achilles tendon can be really important. Hamstrings, thigh muscles, the glutes. Stretching exercises have been studied quite a bit. So over the years, there's a lot of beneficial stretching. There's no real consensus on how long you should stretch. Is it 10 seconds, 15 seconds, 30 seconds? The way I like to think about stretching is it's an important tool in our toolbox. And I have a great video on how to stretch, how to strengthen your foot muscles, braces and supports for plantar fasciitis. Night splints are another treatment that can help stretch your calf and the arch of your foot. This is a great option. I highly recommend this. This can prevent morning stiffness if you're wearing it. I recommend for most people, don't actually wear it at night. Wear it during the day while you're watching TV for like 20-30 minutes. That's usually a great amount of time of stretching. Orthotics, in a way, also help you stretch. I have a lot of my favorite orthotics down below, but essentially they prevent your feet from stretching out. They hold your foot straight. I always recommend a good supportive shoe, good supportive orthotic. And that kind of brings us into number 4, muscle strengthening. Muscle strengthening is really more effective than stretching. I go back to the example of someone punching you. And if someone's punching you the whole time and you're trying to stretch the punched area, it's never really going to get loose. It's never going to get flexible. It's muscle weakness and instability. If you're leaning too much on one side or the other, or your thigh muscles or your back are giving out, that's what makes your feet turn out and overpronate. The weak muscles are what the problem is in most patients that I see. It's not the lack of flexibility. You're only not flexible because you're so sore and stiff all the time. So again, I have videos on improving your flexibility, your stretching, and in fact, I'm going to talk at the end about the 30-day course. Me and Coach Ryan, who's a basketball star, we go over a 30-day course to work on your strength, your flexibility, and transform your health. We go over that specifically down there. We work on diagnosing biomechanical issues, biomechanical instability, and we focus on that specifically there. I know I kind of copped out on the stretching and the muscle strengthening because you're like, hey, you didn't actually show me anything, because I don't think it's that important. Even though they're number 4 and 5 on our list, these top 3 are really what fix it. Let's talk about shoes. There are great slippers and there are great shoes that can give you a ton of support. Now, you don't need a huge shoe like this. There are pros and cons to every shoe. When I look at a shoe, there's like 10 different factors we look at, kind of like heel height, toe drop, how flexible is it? So for example, look at how flexible this is, but it does have an insert in it. So there is an insert in it, but it is flexible. Whereas this one, you can fit an insert in it, plus it can't really bend. It has a big, thick heel through there. There's a lot of pros and cons to different shoes. And I do link my favorites down below. You want to get a good brand. They can make a big difference almost immediately because they prevent your foot from overpronating. It's really as simple as that. You want to be able to fit in it. You want to have room in your toes for your big toe joint, your smaller toes. You want to have pressure off the ball of your foot. You want to make sure it doesn't hold you too stiff, because there's a reason people walk flat-footed. And as your foot turns out, maybe it's to compensate for a knee or a hip. Too much correction right off the bat could actually hurt your knee. The shoes that we have in the clinic are a brand called Orthofeet. I'm a big fan of Orthofeet. They come with a soft insert inside. They come with the proper support. They have proper sides. They have a proper offloaded front and a proper offloaded heel. They meet all 10 benefits that I look at generally for a flat foot. But it's not the perfect shoe for everybody. It is geared more towards an older crowd. It is an orthopedic shoe. If you have structural problems like tight back, tight hips, tight knees, tight feet, potentially peripheral neuropathy, that's probably a phenomenal shoe for you. And I like my favorites down below. But if you're a younger person, if you're a runner, probably not the Orthofeet shoe. There are shoes like Brooks, like Nikes can be good, Saucony can be good, On Shoes can be good, New Balance, Asics, Kuru. There's so many great shoes out there. These are all great brands. The people that really struggle are the barefoot walkers and the sandal people. Take a look at the good supportive brands. There's slippers, there's sandals, there's good supportive shoes. I go over my favorites. I could talk all day about shoes, but it really depends a little bit on your biomechanical exam and the type of shoe you need. Number 2 on our list is orthotics. Take a look right here. When I push down, see how much that flattens? But right here, when I push down, it does not flatten. Same kind of thing. When I push down, it doesn't turn out. Whereas right here, if I flatten, look at how much that foot overpronates and flattens out. An orthotic, this is like a $20 orthotic. There is hardly any pressure here. A proper insole can make all the difference. There's pre-made orthotics and there's custom orthotics. I have specific videos about that down below. I go over every major brand that sells pre-made custom orthotics, like the Power Steps, the Atrix, the Up Steps, the Spenco, the Superfeet, the Walk Heroes. I go over all these. They have pros and cons and different price points. The way you want to think about it is start with something soft, then move to something more firm. Not everybody needs a custom orthotic right away, but a custom orthotic can be much more aggressive and much more fitted to your feet. Usually like $20 to $50 or $80 for a good pre-made orthotic, whereas a custom orthotic can range from like $250 to like $700. Now there's pros and cons. Necessarily the $700 one might not be better than the $200 one, which might not be better than the $20 one. But what you want to do is start soft, get used to it, and get used to more. I like to think about flat feet like a dentist working on a crooked tooth. You don't want to correct it and straighten it all in one go. You want to start soft, reduce the pressure, heal the ligaments. As about a month goes by, go to a more firm orthotic. As another month goes by, go to a more formed shoe and an orthotic. Then you want to get potentially a custom insert to hold you straight. Now, if you're already feeling better on stage 1, You might not need the custom orthotic. And there's a lot of variables, as you can tell. Watch my favorite orthotic guides where I review all the different orthotics and I review custom orthotics. There is ways to get custom orthotics at home. There's brands where you can step in a foam box. There's brands where you can use your iPhone to scan your foot. Or you can come in and see me in Michigan and I use a more advanced tablet and make specific aggressive modifications where you can get even more correction on your foot. Work through those stages. Start with the lower cost ones, see how much effect it has on you. If that's not doing it, move to the more aggressive stages and get that correction. This works like 95+% of the time. I mean, immediately, like in the first appointment, people get huge improvements. But secret number one and remedy number one is you need a full body biomechanical exam. I do go over how to do this at home. I have my 30-day guide with Coach Ryan. We look at your body biomechanics, your diseases, your joint issues, your back problems, your knee problems, your hip problems. I have people sit down in a chair and I move their hips, I move their hamstrings, their thighs, I twist their knee in and out, I move their foot in and out, I bend their big toes up and down, I move their smaller toes up and down. I go up and down, starting from the back to the toes and check pretty much all the muscles, all the joints, and see what's equal and unequal. And then we diagnose which ones are the stiffest, which ones are the most correctable. I do this from college runners all the way up to 100+-year-olds. We work with osteoarthritis, we work with plantar fasciitis, shin splints, all this kind of stuff. It's kind of like unlocking the body because your body is like a series of dominoes. Flat feet especially is one problem is usually causing another problem. And until you fix those, fixing the flat feet might be a problem. So for example, people who are flat-footed, but their knee is really tight, if you fix the flat foot, it can put more pressure on the knee. Or if your back has no flexibility, if you hold the feet straight, now your back all of a sudden hurts. And that's why people hate their orthotics. That's why people hate certain types of shoes. They did not diagnose themselves correctly. You have to start with the 5 core principles. Number 1, you have to work on your muscle strengthening. Number 2, you have to get your cardiovascular quality up. Number 3, you have to be sleeping well so your body can heal your joints and your muscles. 4, you have to be eating properly, managing your diet properly. And number 5, that's where things like supplements